Good afternoon. It's nice to be here in Fall River to highlight the tremendous work that's being done by STAR to support residents of the South Coast in the fight against COVID-19. Before I get into the more details about the work that's being done here, first want to give my daily update on testing and hospitalization. As of yesterday, we've conducted, since we started, over 401,000 tests, with over 6,700 new tests reported yesterday. There were about 870 tests reported yesterday that were positive. That's about a 13% rate of positive tests. That remains somewhere in the general vicinity of 10%, which is where we've been for the past week or 10 days, and that's obviously significantly below the 20 and 30% positive test rates we had when we started doing this back at the end of March and the beginning of April. We still have over 3,000 residents that are in the hospital due to COVID-19, and while we continue to see the number of people needing hospitalization decline very slowly, it has been a very slow roll for the past couple of weeks. Overall, we've seen about a 20% decrease in the number of people who've been hospitalized or who have been in the hospital since that number peaked in mid-April. The administration and the command center continue to have daily conversations with colleagues in healthcare and with the hospitals across the Commonwealth to monitor their capacity levels, and we've been encouraged by those trends so far, but we're keeping obviously a careful watch on the hospitalization numbers because they do tend to bounce around from day to day. Several hospitals are still relying on the temporary space that they set up and staff for this emergency. Obviously, those trends are particularly important to us because they have a lot to do with hospitals' ability to get back into the business of doing the stuff they typically do when they're not battling COVID-19. We remain one of the hardest hit states in the country by the pandemic, and we still have a lot of work to do to continue to contain the infection rate and reduce the number of people that need serious care. We've also distributed over 10 million pieces of personal protective equipment, including masks, gloves, gowns, ventilators, to first responders, hospitals, and other frontline workers to support them in their battle against the virus. And I would just say that this testing site back here, which I'm going to speak about in a minute, the coveralls that are being worn by those folks are being manufactured at Marrow, which is a place several of you visited with me last week, which is right down the street. Neighbor helping neighbor in kind of an unusual way. I also want to thank Nancy Paul, who's the CEO here of the Stanley Street Treatment and Resources, known as STAR, for the work that they're doing to deal with COVID-19, and in addition, their nationally renowned work for substance use disorder care. STAR served as a strong partner with the state, from being an early partner on our Medicaid Accountable Care Organization program a few years ago, to right up to opening this testing site, and an important part of our fight against the pandemic. We value the role of our community health centers. They are leaders in the fight against COVID-19, and we especially appreciate the work they do in many communities in the Commonwealth where they are, for all intents and purposes, the front door and the primary source of health care for many people. Testing remains obviously a critically important pillar in our battle against COVID-19, both now and into the future, especially as we begin to plan the reopening process. The COVID Command Center, along with the healthcare community, got to work early on this to ramp up our testing capacity, and we now are at one of the top per capita testing rates in the country. In fact, if Massachusetts was a country, we would be one of the highest testing per capita countries in the world. There are only several countries that test more on a per capita basis than we do. We have the lab capacity, which we've been working on building up for the better part of the past couple of months, to test about 30,000 tests per day. The labs are currently utilizing and testing somewhere between 8 and 15,000 tests a day, depending upon the day. That's good progress, and it means it's possible for us to continue to expand our testing and have the capability to actually process it and to process it quickly. Folks like STAR obviously have made a big difference with regard to our ability to test at the community health center level, and as we continue to expand our testing capacity to monitor infection rates by region, they also provide care and support services and a series of guidance and advice with respect to what's going on in particular hotspots around Massachusetts. Last week You may recall that we announced an expanded testing partnership with Quest Diagnostics and 18 community health centers across the state, including STAR. That partnership is specifically focused on increasing testing in many of our hardest hit areas, including high-density communities and communities of color. We recognize that many of these areas continue to see high numbers of positive tests, including neighborhoods in Boston, Worcester, Springfield, and in municipalities like Chelsea, Brockton, Lawrence, Lowell, Revere, and Holyoke. Our command center continues to expand the number of available test sites and who can get those tests to continue to grow our response when it comes to testing, because that is in many respects one of the most important ways for us to survey what's going on across the Commonwealth, especially as we start to reopen. Our mobile testing program to conduct mobile online testing, on-site testing at nursing homes, rest homes, and assisted living facilities has now completed almost 40,000 tests at 360 facilities around Massachusetts, and we've also completed over 20,000 tests at facilities that are overseen by the Executive Office of Health and Human Services. And yesterday, DPH issued guidance to update our work around appropriate use of laboratory testing for COVID-19 and expanded testing recommendations for COVID-19 for commercial and clinical labs as well. Those updated guidelines recommended that all symptomatic individuals in Massachusetts, even those with mild symptoms, should be tested. And as a reminder, the symptoms for COVID-19 include fever, chills, signs of a lower respiratory illness, fatigue, sore throat, headache, body aches, or a new loss of sense or of taste or smell. That updated guidance recommends that all individuals in Massachusetts identified as close contacts of COVID-19 cases should also be tested. Early on, everybody remembers that this was certainly one of the barriers associated with getting tested. That resulted in a lot of frustration and in some cases fear of the unknown, and it left our public health experts in some cases with limited awareness of where the virus was. Today, with that added capacity and the hard work from partners at labs, hospitals, long-term care facilities, and health centers like this one here today, and that new guidance, we can continue to expand the number of people who can be tested, and we continue to make progress on that. When we think about the future, we need to be committed to expanding testing to make sure that people who have symptoms have improved access to testing, and that we have the ability to test those with whom they've been in close contact. And we'll continue to provide additional information on this over the course of the rest of this week as we head toward the 18th. It will not only help us understand where the infections are, but it will also help us help people isolate, participate in the tracing program, and return to their normal lives faster. And as we consider our reopening strategy, we view this as a critical component of getting toward a new normal that will help us navigate our daily lives with the presence of COVID-19. And I can't underscore the importance of treatment and a potential vaccine nearly enough, but in the meantime, as the federal government pursues those options, expanded testing and tracing will be essential parts of how we manage our way forward. STAR is one of 36 community health centers that also participate in our Community Tracing Collaborative program. As we think about slowly reopening the Commonwealth, there are many things we still need to do as part of our daily routines. And I'm glad to see so many people here today wearing face coverings in public, maintaining social distance, and washing our hands frequently, and using hand sanitizer whenever we see it. But to really bring the fight to the virus and to get ahead, we also need to identify confirmed cases and the people they might have exposed to the virus, or who may have exposed them to the virus, their so-called close contacts. And that's where this contact tracing program is so important. Last month, we were the first state in the country to set up a contact tracing program, the Massachusetts Community Tracing Collaborative. It's a collaborative between boards of health, the Department of Public Health, and the nonprofit Partners in Health organization to contain the spread of the disease. We believe this tracing program will be a key element toward not only stopping the spread of COVID-19, but also toward understanding the virus and who has it and who's been infected. If you test positive for COVID-19, you will be contacted by the Community Tracing Collaborative or by your local Board of Health. On that call, we want to be sure that you have what you need to isolate yourself while you recover. That might mean food if you haven't been to the store in a while, or other needs. We'll also ask you who else you've been in close contact with for the past couple of days before you started to have symptoms, or a couple days before your positive test if you don't have symptoms. To date, the Community Tracing Collaborative is connected with nearly 18,000 confirmed cases and reached out to more than 14,000 of their contacts since we started making calls about a month ago. The mass COVID team includes nearly 1,600 people making calls. The median number of contacts reported by each confirmed case is pretty low. It's around 2 or 3, and that's a good sign that people are taking the social distancing issue seriously, but that doesn't mean folks should let up on that now. If you are contacted by the collaborative, please take the call and provide the relevant information to the caller, for your own sake and for the sake of your friends and your family and your neighbors and others you've come in contact with. Those phone calls will come from an 833 or an 857 number, and your phone will say the call is from MA COVID Team. This is very important. If you see MA COVID Team show up on your phone, please pick it up. And we'll continue to do all we can at the state level to push back against the virus and to work with others to contain the spread. This, in many respects, if you get one of these calls, will be a great opportunity for you to fight back against the virus and help us continue to contain the virus and make it possible for us to slowly reopen our economy. Finally, I'd like to highlight STAR's efforts to make recovery and isolation sites available for people who test positive with COVID-19 here in the South Coast. On April 1st, the Command Center and MEMA launched the first regional isolation and recovery site in partnership with the Commonwealth Care Alliance for homeless and housing insecure individuals that test positive for COVID-19. Today we have 9 isolations and recovery sites in Everett, Lexington, Taunton, Worcester, Northampton, Pittsfield, one that is shared by Chelsea and Revere, Boston Hope, and the Newton Pavilion, both in Boston. They were set up with the state in partnership with local municipal and healthcare leaders. People who stay at the isolation and recovery programs are provided with a hotel room and 3 meals a day. Many services are also available on site to ensure individuals stay safe throughout that isolation period. And across the state, these sites have served about 800 COVID-positive individuals, providing them with a safe environment to recover and then return to their communities. STAR's referred many individuals to our isolation recovery sites so far, and I want to thank them again for their work on making sure that they're doing the things they need to do to help people avoid spreading the virus here in the South Coast. In addition to homeless and housing insecure individuals, the Commonwealth also expanded eligibility for regional isolation and recovery sites to include low-income individuals who are diagnosed with COVID-19. Those referrals can come from community health centers, healthcare providers, and the contact tracing program, because these individuals may need a safe space to isolate due to either a high-risk housing situation, overcrowding, for example, or they may live in a household with one or more vulnerable adults who live with them. STAR's done tremendous work to provide support and services for different stages of COVID-19 and for many of the populations who struggle to deal with this on a daily basis. Their participation to increase testing, support contact tracing, and provide recovery sites for those in need will go a long way to supporting this region. The system of surveillance, isolation, and tracking is key to getting our arms around this virus, stopping the spread, and informing us as we pursue next steps. And we're grateful for your efforts here in Fall River and to everyone participating in this program statewide. It makes a difference, and it really matters. And I want to thank Nancy and the team for hosting us and for all that they're doing. Now I want to welcome Nancy to the podium to say a few words.
I just want to thank the governor for his leadership. I was telling him that I had been on a United Nations mission at training Afghani physicians, and I arrived back on the 14th. And on the 15th, all hell broke loose, and it just was unbelievable, and the changes that we had to institute so quickly. We had no PPE. We had no tests. Um, and within 3 weeks now, we have tested over 1,000 people. Today we'll hit 1,000 people of testing. We have enough PPE and we have systems in place. And I don't know any other state that would have such rapid turnaround. And it's all due to the governor's leadership, and I want to thank him. I want to thank Merrill Manufacturing for the suits that our staff are using behind me, and for Matuk for the masks that our non-medical staff are wearing. So thank you, Governor. Thank Mary Lou for me, Sutters. She's done a fantastic job by your side. Thank you so much.
Questions for me or for Nancy?
May 18th is less than a week away. Just talk about what you envision happening next week. Should the average person in Massachusetts expect their daily routine to change at all on Monday?
Well, I guess the first thing I would say is we've said for a while now that similar to the approach that's being pursued in other states, frankly, and in other countries, this is going to be a phased reopening. I said almost 2 weeks ago that this isn't going to be a situation or a circumstance where on May 18th every business in Massachusetts that's currently closed is going to be permitted to open. It's not going to work like that, and it shouldn't work like that. People have gone through a tremendous amount of dislocation and discomfort and lost wages and a whole bunch of other things over the course of the past 60 days to get to the point where the virus has been contained enough and reduced enough that we can actually start to reopen the economy. The last thing we're going to do is reopen it in a way that fires that virus up again. I say all the time that in the end, we should all think about where we want to be as we go down the road here several months from now, not about necessarily where we want to be tomorrow. I would love to be able to open everything up tomorrow. That would be an incredibly irresponsible thing to do. What we are going to do is phase the reopening. The folks who are going to open initially are going to be the folks who we believe are most likely to be successful in reopening and not further spreading the virus. That means the kinds of organizations that don't have a lot of close contact with customers, or the kinds of organizations that are designed in such a way so their ability to execute on a strategy around distancing would be relatively uncomplicated for them to do. And this is going to require patience, and I understand that. But in the end, when we reopen, we're going to want to be able to sustain that reopening over time as we continue to test and as we continue to hospitalize people who get sick, and as we continue to sort of battle and work to contain the virus through the contact tracing program and some of the other initiatives we're pursuing here. And that's going to mean what I would refer to as sort of a slow roll out of the gate. And I respect and understand why people would like to go a lot faster, but I just want to remind folks that we still have 3,000 people in hospital beds. We still have almost 1,000 people in intensive care unit beds. We still have many hospitals in Massachusetts, which, as we all know, is world-renowned for the quality and capacity of our hospital system and our healthcare community. We still have hospitals all over Massachusetts that are operating ICU capacity and COVID-19 capacity that's significantly beyond what they would be operating at if they were just running a normal operation. This is not a virus to be trifled with or disrespected. And I think it's important for everybody to understand that. And I get the fact that that's going to lead to a level of sort of patience associated with this that will make people uncomfortable. But I want us to reopen Massachusetts in a way that makes it possible for this to be successful.
Governor, pressure.
Can you tell us a little bit, like who? When you talk about businesses that don't have a lot of close contact, there's a lot of anxiety on both sides. Some people who don't want to reopen so quickly, some people who do.
Yeah, I've noticed that. Yeah.
Can you give us a sense of the types of industries you're talking about who may be included in a phase one and who may not?
Yeah, I'm not going to speak to this until we issue the report, and the main reason for that is I want this to be done in a deliberate way, and you don't do something in a deliberate way if you start leaking it out and issuing it out before you actually release the report. I don't want the starting gun, so-called, to go off today or tomorrow. I want it to go off on Monday, and I want it to go off on a targeted and phased way, period.
Governor, do you plan on returning with all the deaths in the nursing homes, majority of the deaths being in nursing homes, do you plan on returning campaign donations to those nursing homes from those bosses?
So first of all, this virus, for all kinds of reasons, has been profoundly difficult for long-term care providers in every part of the globe. If you think about the way, which has led to tremendous tragedy, but if you think about the way a long-term care provider operates, the good ones, because of the population that they're serving, spend a lot of time in extremely close contact. They bathe people, they dress people, they feed people, they transport them, they recreate them. And if you think back 60 days ago, most people didn't even appreciate at that point in time that many of the people who carry this virus don't even have any symptoms. And I think in some ways it was perfectly designed to create far more havoc and sorrow in long-term care facilities than in almost any other place you could think of. And that's not just been true here. That's been true in every state in America that's had an outbreak, and it's been true in other countries as well.
Your campaign is to save 52,000.
A lot of high schools are trying to figure out graduation plans. What would you
Yeah.
Are you going to give an update on gathering sizes soon? I know a lot of people are trying to plan for that. And
Yep.
you have to have multiple backup plans.
Yeah, we're having conversations right now with a lot of folks in the K through 12 community about the fall, but also about graduation, and we'll have a lot more to say about that on Monday.
Back to the nursing home.
Testing, of course, that's vital to the reopening. Are we going to get to a point where anyone...
Say again, Jonathan?
Do you think we'll get to a point where anyone can be tested, whether they're sick or not?
We're going to have a lot more to say about testing before the end of this week, and I think the approach that we're going to, first of all, if we were a country, we'd be a top 5 country in terms of testing per capita in the world. All right, we are a top 5 country, or top 5 state with respect to our per capita testing in Massachusetts, and we believe we need to significantly enhance our testing capacity, which is why we've created the capacity to do about 30,000 tests a day. We currently do, a third to a half, depending upon the day. But we do believe that we need to enhance our testing program, and we plan to ramp it up in a pretty big way over the next several months. Yeah.
Does that mean universal testing, so like anyone could get a test and feel safe?
I think it's more likely to be a testing program that is targeted on the populations and the industries and the individuals who are most at risk. I mean, that really would be the place where you'd want to focus a lot of that activity. And remember, one of the primary reasons that we talk about wearing masks, if you can't be physically distant from others, is because of that asymptomatic issue associated with this virus. If some really significant percentage of the people who get this virus don't ever show symptoms, which means they don't know they have it, they are most likely, if they don't wear a mask and if they don't distance, to give it to a lot of other people with no knowledge that they were even sick in the first place. So if 2 people are wearing a mask, the likelihood that they are going to commit transmission between them drops dramatically. And I can't express how important that our behavior and the decisions we make with respect to our behavior are going to have a lot to do with containing transmission. Now we're going to ramp the tracing program up in a really big way so that we will contact people who do test positive and their close contacts. But there's 2 issues here. One is, what are we collectively and individually going to do to ensure that we don't spread the virus, okay? And that has to do with face coverings, distancing, hand washing, hygiene, and all the rest. The second thing we're going to do is significantly enhance our testing program, especially for those who are in what we would call high-risk areas and high-risk professions, so that they are being tested on a pretty regular basis, so that if somebody does test positive, we're in the position to do something about it with respect to both them and their close contacts.
Governor,
The Mass Nurses Association is asking you to put together an advisory of frontline nurses, doctors, what have you, to meet and discuss with you ways to get the medical community up and running once you're opening up. Is that something you're considering doing, meeting with them?
I think well, first of all, there are ongoing conversations with a lot of folks in the healthcare community, at the nursing level, the social work level, the management level, sort of across the table, and I fully expect that on a go-forward basis, those conversations are going to have to continue, because the healthcare space will go through a similar kind of phased reopening that other people are going to go through, because remember, unless you've been inside or you've been talking to them, you wouldn't necessarily know this, but they've pretty dramatically changed the way they're organized and the way they've operated to deal with COVID-19, and to go back to doing things in a more traditional way is going to require some pretty significant changes that are going to require input and guidance and advice from a lot of folks, including folks on the nursing side.
What do you say to public health experts and scientists who are coming out and saying May 18th is too early to ease restrictions, and in fact it could endanger the sick and the elderly?
Yeah, I guess the first thing I would say is that we said all along that one of the reasons why we're issuing this report on the 18th is because we wanted to have a report in place at or around the time when we felt a lot of the data that's critical to making this decision would be in a place where we could anticipate it would be possible to engage in a phased reopening. But we take quite seriously, we have a medical advisory board that advises the command center. We have public health and healthcare people who serve on the reopening advisory board, and we talk to the healthcare community, I do every day, about what's going on out there. So we take their advice and their guidance very seriously, and part of the reason why we want this reopening to be phased and to be a slow roll is because many people in the healthcare community have made absolutely clear to us that that is the only safe way to go forward here. And we are going to continue to track the same things that we've talked about with you all for the past month or so as we go forward. What's our positive test rate? What's going on with hospitalizations around COVID? What's going on with respect to ICU days? All the things how many hospitals remain in surge, all the stuff that we've been talking about for the better part of the past 2.5 months. And across most of those categories, as I said in my remarks, we have made progress over the last 30 days.
Last question.
Governor, can you explain? Only 33 deaths reported. I know that may be an anomaly.
I'm sorry, say what?
It was just 33 deaths reported yesterday,
Yeah.
and you'd have to go back to April 6th to find a number that low. Is that further good news, or is that an anomaly that maybe we're not turning the corner as quickly as we think?
Well, one of the reasons we track and measure, we give the daily updates, right? But one of the reasons we track all of these measures that I just talked about on sort of 2 or 3 day or 5 day rolling averages is because the reporting, depending upon where it's coming from, can be a little lumpy. And I don't know specifically why we had such a low number reported yesterday. But I would say that if you look at most of our data, including our death data, right, it has been going down on any kind of a 2, 3, 4 day weighted average for the better part of 2 weeks. But there's been some bumpiness in there as well, which is the same type of thing. If you're asking me, do I think we're going to have a number like 33 today? I would say probably not.
What you mentioned yesterday, you're going to make a game day decision on the stay at home advisory on Monday. That too is causing some anxiety. Why wait to make that decision until that very day?
Again, we want to go slow. You don't go slow if you start making decisions and announcing decisions before you get there, okay? And we've also said we wanted to make this decision based on data. We've been tracking this stuff, as you all know, for the better part of the past few months. We have seen positive developments, but I've also said that we've seen some circumstances in which we started to go like this and then we went like this, okay? I want to make sure that we have all the data we need when we make this decision. And to get back to your point, there are a lot of folks in the public health community who are very concerned that we need to go slow on this because they're worried about a reignition of the virus. And our goal here is to go we understand why people want to reopen, okay? Believe me, I get that. And I respect that and I understand it. But I want to make sure that when we do this, we do it in a way that is sustainable. And one of the ways you make this sustainable is by making it a phased implementation over a significant period of time. And I get that for a lot of people that will be unnerving. But the mere fact that we're even talking about doing this is obviously unnerving to some of the folks in the public health community as well. And I understand that too.
I get the cautious approach, right?
Yeah.
But why not extend it?
Like I said, we'll have more to say about that on Monday.
Governor,
Thanks, everybody.
Governor, your campaign took $52,000.
Thanks, folks. It's good to see you.
You're going to return that money?